I've been with Dr. Javarsh for many years now, and working with him is challenging. And the fact that we don't do the same thing every day. We don't do the same procedure for everybody. It could be the same procedure done different ways. So our technique has to evolve. My job is to make sure that he flows through the procedure so flawlessly and quickly so that patient is not in the chair longer than they have to be. So when I come in, my room has to be perfectly set up. I'm a little OCD about it in regards to the way my instruments are done and how everything is placed. So when he's in there, and I know as soon as he picks up a handpiece, my head is already 3 steps ahead. I know he's gonna go in there. I know there's gonna be saliva. I need to know that everything is dry. I know the next instrument that's gonna be in his hand. And from there out, I'm already done in the procedure in my head before we're done. So I make his job a lot easier. All-on-4 is all new for me. I thought implants were just placed and you just cement a crown on there and call it a day. But it really isn't that way. It is more of, you really have to look at it the way the doctors do. You have to see the quality of bone. How much bone is it? Is there enough space for an implant? So it's more of thinking how the restoration is going to look before you even think of the implants. So I always quote doctor because this is what he says to all of us. You have to start with the end in mind. So you always have to picture the end finished product before you do the procedure. Not a lot of people know that when he does something and it looks perfect, he doesn't think it's perfect. He may think, you know what, I probably could have done something a little better. So he's very hard on himself in regards to cosmetic and function-wise. And I don't think anybody knows that about him. He's really, really hard on himself in regards to how he performs and what he produces on patients' mouth. He really takes in mind on what their needs are. You know, we're like the Brady Bunch. You know, we have the jokers, so you got the people who are a little moody sometimes, and it's just, we all bring the best out of each other. I think it's our connection with one another and working with each other over the course of years. And I don't think I can come into another practice and not have that kind of bond with my girls and my doctor.